Good afternoon, everybody. It's Paul Hammis, your CEO here at Hugh Chatham, and we have a very special edition for today's video update I'm really excited about. Our goal is to stay connected with you and to bring you important information, also to highlight some of the changes across our entire healthcare system as we continue to adapt in our overall COVID-19 response. And I am especially proud of all the amazing care that is provided on a daily basis in our Hugh Chatham Medical Group. And you may know that we have 25 practice sites across 5 counties and 2 states. And on an annual basis, most recently, we were projecting about 180,000 or more visits across those practice sites. And that's been one of the primary areas of growth in our system. And it makes sense. Healthcare is an outpatient business, and we want to create excellent access to care. And it really starts so many times in a clinic setting, in a physician practice, in an urgent care or an express care. And so I'm extraordinarily proud of our team, our physicians, our advanced practice clinicians, management, and all of our frontline staff in those support practices. I want to thank you all because as a community healthcare system, we have continued to be there for our community in these extraordinary times. And so I want to introduce our guest today. We're really blessed to have so many talented providers on our team, and Dr. Mary Emma Barris is no exception, who's been with us now for several years at Hugh Chatham Family Medicine in Elkin, and she also provides excellent care in our independence-based practice. And so Dr. Mary Emma Barris also is a leader in our Provider Leadership Council. And she specifically facilitates our clinical informatics subgroup of the Provider Leadership Council and does such a great job with that. And she additionally was an early adopter in our transition to virtual visits here recently as we adapt to make sure that we meet patient care needs no matter the conditions. And so I'm really delighted to have Dr. Barris with us. Also, we have Andrew Tate, our Chief Practice Officer, and we have Leanne Hooker, who is one of our key leaders across the Hugh Chatham Medical Group. So I'm so thankful to both of you for being here as well. And with that, we thought we would highlight our Zoom technology. We hope that it works well for this segment. But I want to go ahead and start out by asking Dr. Barris just a general question. And that is, Dr. Barris, how has our world changed in the practice setting from your vantage point during this COVID-19 response?
Well, I think that a lot of us probably have become very familiar with more telephone calls coming in and trying to answer people's questions more directly without them necessarily coming in, particularly if they're high risk. There's been a lot more refills as insurance companies have allowed patients to refill medications early. One of our practice sites, our sites in Virginia, they're in stay at home until June 10th. So those patients are particularly, it seems to me, a little more anxious. And then I find that patients are all anxious above and beyond what we typically see. And so it's really important for us to try and maintain the calm that we might not necessarily be feeling inside where we're trying to take care of people. And we might not have the answers for anything, but I think trying to maintain that level of calmness has been really important. And of course, we've been using telemed more in the last 2 weeks.
Thank you. That's that answer. What has been, what do you think is the biggest upside, and maybe what do you think is the biggest challenge when it comes to interacting with patients using technology platforms like virtual visits or telephonic interactions?
I think initially when we started this, we started looking with our Medicare patients based on the recent relaxed laws and regulations regarding HIPAA from CMS, and that what we find is a lot of our patients are on fixed incomes and have sometimes limited education, and they don't have a smartphone, they don't have an email address, they don't have a computer. And so what we've often relied upon are their adult children or even grandchildren at times to help with some of these meetings. It's challenging at times when they can't use Zoom, and so we find that we've been using some FaceTime. You can use your Facebook Messenger, you can use Skype, so you don't necessarily have to use the Zoom platform or the Snap platform. There's lots of different ways to do it. What I try and have people do is I have my office staff call patients in advance, hopefully to get that email address so I can use Zoom and not use my own personal cell phone number in a chat message or whatever. And I have them try and get vital signs. A lot of our patients have that capability at home to get their blood pressure and their pulse and their temperature. A lot of patients have a pulse oximeter at home. And some people are already checking it twice a day. You can, if you're using particularly a smartphone, after what I try and do with the client or the patient is to get the vital sounds down first, because I'll often forget if I don't do that straight out of the gate. And then I will sit there and talk about how they're doing, do the basic history, and I try and use the video chat on an iPad while using my regular laptop for my Prime Suite interaction. And you can also teach patients how to turn the phone, to flip the camera around and use the flashlight to look in their throat or to see a particular rash better, things like that. So it takes a little bit more time, a little bit more patience, but it's certainly better than treating somebody over the phone. Obviously, the limitations are that you can't listen to somebody's lungs, but you can hopefully get those numbers and see that they're breathing easily. And you can still do the most important thing, which is manage their chronic illnesses. Mm-hmm. So it definitely has its advantages.
Thanks, Dr. Barris. What's been the biggest challenge for you as you have transitioned part of your practice to a virtual practice?
You really almost have to allow twice as much time because everybody's so new at it. Sometimes there's some trial and error. Sometimes you have to reschedule a patient for later in the day. So I think that's been the biggest challenge, is just getting the technology in there. Some of our younger patients do quite well with it. I think as we do it more, that it will get easier, that people will have it. They will have done it once or twice. I've talked to several patients who've done it with their cardiologist the week before. So I anticipate, while that's currently the hardest aspect, I think that will get easier the more we use it.
Mm-hmm. And I'm curious, do you see some of what we have been doing now in part inspired by the need to do it quickly and maybe use some newer approaches to patient care? Do you see some of this carrying forward when things return back to perhaps a more normal kind of environment?
I would like to think that a lot of it will carry forward. I still prefer to have the patient in the office, but for a lot of our patients that are less mobile, or if you're really just reviewing somebody's blood sugars with them and trying to instruct them how to ingest their medications, that it's a great platform. Mm-hmm. So I do foresee it as something that's quite useful. Or say if you're following somebody with cellulitis, had a patient last week who had this cellulitis on her face, and it was good to be able to see that and make sure that we were making progress instead of having her come in.
Mm-hmm. Well, thank you. It's really interesting to see what is possible when we are able to leverage technology and when we adapt. It's very inspiring, and we appreciate all that you're doing to adjust and adapt. And I wanted to ask Andrew and Leanne if they had any thoughts they wanted to share from their perspective around what they see happening across the medical group, across our various practices, things that are going well, some of the challenges that we're working through as well.
So as Dr. Barris mentioned, our practices were hit overnight with COVID-19. We drastically changed the way that we do things with the telehealth visits, having all of that available for patients pretty readily, having our providers also see patients in the office as well as work in these televisits. So still having access for patients is very important to us. We want to make sure that you have availability 5 days a week, Monday through Friday, just as you have in the past at all of our practices. We may decrease the staff that we have there to help support our other practices, help support our hospital in areas of need when we have, patients that need increased staff support. And then redeploying our staff so that we have nurse practitioners, we have PAs and MDs all in our practices that are willing to go to the hospital, round with our hospitalists, learn their techniques, and continue to support our hospital in the need in a time when we may have a massive surge of patients in our area that we just don't have sufficient staff for. So pulling, all of our staff and resources from all of our practices and putting them into our organization and other roles It's been amazing to see our whole medical group step up to the plate, knowing that there's going to be a time that there's a huge demand. And this is why we all came into healthcare, is to help people and make sure that we see them through a difficult time. They're scared, and our providers have done an amazing job educating patients, redirecting their fears, and just being there for them, stepping up, like I said, and learning the hospital, making sure that they're available when there's a time that we need them in the hospital.
Mm-hmm. Very, very well said, Leanne. Thank you for that. Appreciate your leadership. Andrew, from your perspective, how do you see things changing, and what are you enthused about, and what do you see as some of the challenges we're facing across the medical group?
Yeah, so super super excited about the confidence that I've seen among the medical group, and Dr. Barris mentioned that earlier about how this is a unique time for our medical group, and how the confidence of the provider really puts the patient at ease and our staff at ease as well. So I really appreciate that. Our group has worked tremendously hard from the beginning to eliminate barriers to access to care. So that is our main objective and mission, is make sure that our patients can see us easily and readily. So SNAP platform, the Zoom platform, both for telehealth and virtual care, we have implemented very quickly without the support of the providers and staff alike. That couldn't have been possible. So we've actually seen about 91 virtual visits so far across our medical group. We're only talking about 11 days, and that includes weekend days as well. So it jumped off very, very quickly. I think thanks to Laura Oakes from a marketing perspective, all the way down to Sandra Wood and Kayla, both in accounting, to make sure that we get paid for the visits. Anna Robinson from a coding perspective too, and the business services side of the hospital, all people who deserve a lot of recognition for this. Jennifer and Ashley Marion actually originally started on the platform, both of which we gave direction in about 15 different ways and changed the course of direction numerous times as we're learning the product, both of which have been extraordinarily easy to get along with and have just sort of taken it in stride. We kicked off telemedicine as a whole in about 2 days. Right now we're on demand. You can hop on our website and get a Hugh Chatham virtual care at the bottom right corner of the website. And there's also a scrolling banner at the top. As a new patient, you can log on in a matter of just minutes. Our average wait time is under 9 minutes right now. So that's access to care, which we're really, really excited about. Leanne's watching that queue for our patients and providers alike 24 hours a day, so she doesn't get much rest. so right now we're really excited that we can offer care so quickly. And then as far as communication with the public, I know Laura's worked really, really hard to make sure that we get this out in a variety of mediums to make sure that the public's aware of the service that we're providing. So we certainly have challenges, no question, but I think we're adapting to those challenges very, very quickly. And there's lots and lots of people that I could thank and really appreciate from that perspective.
Thank you, Andrew. I really appreciate your acknowledgement of our core value of teamwork. It's alive and well, and it does take so many people from so many different areas to support patient care. So very, very well said. So as we close down today's segment, I want to give Barris the last word. And Dr. Barris, what kind of advice would you give to all of us, whether it's best practices to limit spread, or whether it would be just general advice that you'd have to anybody who's listening right now?
I guess the best advice is to try and stay calm and realize that while things are changing daily, that there will be at some point some normalcy coming up, hopefully in the next several months. And as long as we keep working together and realize that the other person is also underneath stress, that we can give each other a little bit more room to navigate this uneasy time. So just to be patient with everybody.
Well said. Thank you so much, Dr. Barris, Leanne, and Andrew for joining us for today's video update. And again, I thank everybody for the amazing job that you're doing to make sure that we never lose focus on why we exist, and that is to care for our community. Have a wonderful day and stay tuned.